Harrow Council has just dropped one of the biggest home care tenders we've seen in London this year. We're talking £21 million a year, up to 8 years of work and 7 different lots you can bid for. If you're a domiciliary care provider anywhere near North West London, you need to pay attention to this one. In this video, I'm going to break down everything you need to know about the Harrow Home Care Framework tender. We'll cover the different lots available and what each one involves, the key eligibility requirements you absolutely must meet, the critical deadlines you cannot miss, and whether this tender is actually right for your care business. By the end of this video, you'll know exactly where you stand and what your next steps should be. Let's get into it. So, the London Borough of Harrow has published what they're calling the Home Support Harrow Framework. This is a major re-procurement of their domiciliary care services, and they're looking for providers across 3 distinct service categories. First up, you've got long-term home care for adults aged 18 and over. This includes support for people with learning disabilities, autism, and mental health needs. Second, there's adult re-enablement support services, shorter-term, intensive packages designed to help people regain their independence. And third, home care for children and young adults with disabilities, which they're calling CYAD. Now, let me put the scale of this into perspective for you. The council has estimated this framework at £21 million per year. The framework itself runs for up to 8 years. That's an initial 3 years, then another 3 years, then an option to extend for 2 more years after that. This isn't a one and done contract. If you get onto this framework, you're potentially looking at nearly a decade of steady work with Harrow. Here's what's really interesting about how they've structured this. The council has divided Harrow into 3 localities: Harrow West, Harrow Central, and Harrow East, and they've created 7 separate lots across these areas. For the long-term adult home care, that's lots 1, 2, and 3, covering each locality, and there's no cap on the number of providers. So if you meet the requirements and score well, you're in. For the re-enablement services, that's lots 4, 5, and 6, and this is where it gets competitive. They're only taking a maximum of 3 providers for Harrow West, and just 2 providers each for Central and East. And for the children and young adults work, that's lot 7, covering the whole borough, with a maximum of 6 providers. Now, here's something crucial. You can actually bid for multiple lots, but there are some restrictions on combinations, and I'll come back to that in a moment. Right, let's talk about whether you can actually bid for this tender. This is the bit that will save you a lot of wasted time if you don't meet the requirements. First and foremost, you need to be registered with the Care Quality Commission to deliver domiciliary care in Harrow. And here's the key bit. You must have a minimum overall CQC rating of good. If you currently rated requires improvement, this tender isn't for you right now. The council is really clear on this. If your CQC rating is below good, your bid will fail at the qualification stage. No exceptions. You also must have an effective electronic call monitoring system in place. This isn't optional. The council wants to see that you can log calls in and out at each location, track punctuality, and monitor missed visits. If you're still doing paper-based records, you've got some catching up to do. On the insurance front, you'll need employees' liability at £10 million, public liability at £10 million, and professional indemnity at £5 million. If you haven't got these levels of cover, speak to your broker now. You also need a documented business continuity plan. The council wants to know you can keep delivering care even when things go wrong. Staff sickness, severe weather, whatever it might be. Here's one that catches people out. You must sign the council's climate commitment charter. This is a pass/fail requirement. If you don't sign it, your bid won't be evaluated. Now, I mentioned that there are restrictions on which lots you can bid for. For the long-term home care lots, you can apply for a maximum of 2 localities. For re-enablement, you can only apply for 1 locality, and you can't be providing long-term care in the same area. For CYAD, you need to be able to operate across the whole borough. The maximum combination, you could potentially deliver it across 4 lots, 2 long-term localities, 1 re-enablement locality, and the CYAD borough-wide lots. All right, let's talk timeline, because this is where I see providers trip up time and time again. The submission deadline is the 25th of February 2026 at 1 p.m. That's your hard deadline. Not 101, not I'll email it separately, 1 p.m. on the 25th of February through the London Tenders portal. If you miss this and your bid won't even be opened. Now, I'm recording this in January, so you've got roughly 5 to 6 weeks depending on when you're watching this. That might sound like plenty of time, but let me be straight with you. It's not as much as you think. There is a clarification deadline, which is the 13th of February 2026. If you've got any questions about the tender documents, you need to submit them by the 13th of February. After that date, the council won't answer any more queries. So read those documents early and get your questions in. The contract is due to start on the 1st of September 2026. The council wants providers mobilised and ready to deliver from the 1st of September. Factor that into your planning. The message here is clear. If you're serious about bidding, you should have already started. And if you're just hearing about this now, you need to get moving today. Now, here's where it gets interesting. Let me walk you through exactly how Harrow is going to evaluate your bid. Quality is king. The evaluation split is 90% quality and technical, 10% social value, and price is pass/fail. Let me say that again. Price is pass or fail. The council has set out fixed hourly rates and you either accept them or you don't. For long-term home care, the price is £19.50 per hour. For reablement, it's £20.20, and for CYAD, it's £23. So if you're thinking you'll win this by being the cheapest, think again. This tender will be won on the quality of your written responses. There is a quality threshold. You need to score at least 52% on the quality and technical questions to even be considered. Fall below that threshold and your bid is eliminated, regardless of anything else. For the restricted lots, the reablement and CYAD services, only the highest scoring bidders will get a place on the framework. So you're not just trying to pass, you're trying to be better than everyone else. The core questions focus on person-centred care, equality and diversity, safeguarding, staff recruitment and retention, and technology. For the lot-specific questions, they want to see you understand the particular needs for each service user group. The council wants evidence, not generic statements about how great you are, but specific examples of how you've delivered these things before and how you'll do it for Harrow. There's also the reality check. Here's what I've seen happen too many times. Good care providers who genuinely deliver excellent care every single day, submit bids that don't reflect the quality of their service. They answer questions in a rush. They don't provide evidence. They copy and paste from previous bids without tailoring to Harrow. And then they lose out to providers who might not be as good at delivering care, but who are very good at writing tender responses. A bid document is essentially a job interview on paper. If you don't present yourself well, you won't get the job. So, what should you do next? Option 1, you go it alone. You can download all the documents from the London Tenders portal, work through the specifications and write your own submission. If you've got experience with council tenders, a strong internal team and the time to dedicate to this properly, that's absolutely a valid option. Option 2, get expert support. If you want to maximise your chances of getting onto this framework, that's where CareSync Experts comes in. We specialise in tender writing for care providers. Whether it's domiciliary care, supported living, complex care, this is what we do every single day. We've helped providers across England win contracts with councils just like Harrow. Here's what we offer. Tender analysis. We'll go through your documents with you and give you an honest assessment of your chances. If we don't think you're ready for this one, we'll tell you. We also offer complete bid writing. We write your submission from start to finish, tailored specifically to what Harrow is asking for. Then review and enhancement. If you already started your bid, we can review what you've got and strengthen it. And last-minute support. Even if the deadline is getting close, we can help. We're used to working under pressure. The link to book a call with our team is in the description below. If you're serious about getting onto this framework, get in touch while there's still time to put together a quality submission. Thank you again for watching and make sure to contact CareSync Experts if you want to be in with a chance of winning.